Awesome. Is that showing? Thanks, Sam. Cool. So, as mentioned, we'll go into discussion at the end, but we'll just give some information about the background of He Ara Āwhina, how it was developed, and why we've been working on this monitoring framework. So the Mental Health and Wellbeing Commission was established last year in February. We have a particular role. Our background is in He Ara Āwhina, the government inquiry into mental health and addiction, where people talked about the need to have a strong watchdog organisation. We were described as the missing piece of the puzzle of a system that's aiming to improve for people in whānau. So following the 40 recommendations, one of those recommendations that the government actioned was establishing a new commission focused on mental health and wellbeing. We have a role giving system level oversight and leadership, and we have specific functions that relate to monitoring and reporting. We assess and report on wellbeing for all people in Aotearoa, and we also monitor mental health and addiction services and make comments around the appropriateness, efficacy, effectiveness of approaches to mental health and addiction. We also have a strong role as an advocate, and this is something that everyone at the Commission is very adamant that we step into strongly, and we are a bold, brave speaker of truth to power where needed. And we have a function that our advocacy work must be informed by people's experience, so folks with personal experience of mental distress, of addiction, or both. So He Ara Āwhina is a framework that describes what an ideal mental health and addiction system looks like, and we're aiming to use He Ara Āwhina to deliver on those functions of monitoring mental health and addiction services, but also more broadly to monitor changes as the mental health and addiction system transforms over time, and as a basis for our advocacy work to improve mental health and addiction system, including those services. Back when the initial commission was holding space for the commission to begin its mahi, we knew that the role of monitoring services was going to come across to the new Mental Health and Wellbeing Commission. Previously, it had been held by Health and Disability Commission. Kevin Allen, who was in the Mental Health Commissioner role until the Mental Health Wellbeing Commission's establishment, was in charge of publishing reports regularly looking into the quality of mental health and addiction services. And that function was to shift to the Commission when we were established. So in preparation for that, we talked to people and communities about that monitoring function. We knew we were going to be picking this up, and we wanted to know what we should be monitoring and how we should go about this new monitoring role, and make changes to that if people and communities expected or needed us to. Some of the key feedback we heard was the importance of looking beyond just services. People told us that what supports in a journey through distress, through substance harm, gambling harm, and in our recovery and wellbeing isn't confined to services. And we need to have a look across the whole mental health and wellbeing system to include the policy environment, to look at community supports and the resources that are available to people in whānau to support themselves through distress, through substance harm, through gambling harm. Picking up that feedback, or the other key piece of feedback, of course, was the importance of hearing people and community voices in that monitoring. So picking up that need to be listening to people, actioning what people have said about their experience using supports, using services, and also looking at the system more broadly. We brought together an expert advisory group last year who have been developing the draft framework that we're sharing now for further feedback and public consultation. A Māori expert advisory group developed the Te Ao Māori perspective, and the shared perspective of the framework was developed through our EAG, as well as a number of focus groups and conversations with people who brought a number of different lenses and expertise to that. This is a list of the members of our expert advisory group. So we were really blessed to have a lot of people with varied knowledge and just so much skill and wisdom to contribute, including a large number of folks who brought lived experience perspectives, people who had clinical backgrounds, public health backgrounds, and folks who had either professional or personal experience with addiction involved as well. And together, this is the framework that has been developed. This is our draft He Ara Āwhina. So on the left-hand side, we've got the Te Ao Māori perspective, which talks about 6 domains that need to be actioned in order for services and the system more broadly to be responsive to Māori. Mana whakahaere, mana motuhaki, mana ora o tūmānako, mana tangata o tū tangata Māori ora, mana whānau, whanaungatanga, and kotahitanga. And on the right, the shared perspective is around what services and the wider mental health and addiction system need to be doing to support people, all people in general in Aotearoa. And the focus there is around equity, participation and leadership, access and options, upholding safety and rights, providing connected care, and of course having effective system. Today, we're quite keen to delve into a few broad questions with everyone. We're keen to know whether He Ara Āwhina reflects your hope for the mental health and addiction system. If so, what is there about the framework that feels hopeful? If not, tell us about that as well. We're really keen to hear feedback, no matter what it is that you'd like to share with us, because this is an opportunity to genuinely make changes and improve this framework for our monitoring, which will start next year. Is there anything important to you that's currently missing that we need to look to add? And is there anything else that you want us to know about how we go about monitoring the mental health and addiction system? I appreciate some people will had an opportunity to open that big framework document and have a delve into it in advance of this meeting, but other people will not. So we'll just do a quick summary of the content that sits under those shared perspective domains, because that's really what we're keen to have discussion around today. If anyone is here who has particular interest in the Te Ao Māori perspective, Guy, alongside Julie Whareweramika and Kerry Butler, are hosting a number of sessions as well to hear feedback on the Te Ao Māori perspective. So feel free to flick Guy a message if you'd like to be involved in one of those other conversations as well. So I'll hand over to Alana for taking us through equity and participation and leadership.
Awesome, thank you so much, Kelly. Cool, so the first domain is equity. So the overarching statement for this domain is: we, tangata whaiora, people seeking wellness, want a mental health and addiction system that upholds equity and supports all of us and our whānau. So the specific steps under that are: the mental health and addiction system fulfills te tiriti o waitangi obligations, services treat us equitably and take action to decolonise practice, increase workforce diversity, apply intersectionality and address inequities and systemic racism. We benefit from mental health, alcohol, gambling and drug law reform that puts human rights, wellbeing and equity at the heart. The justice system actively diverts and supports us when we are experiencing harm from substance use or gambling and mental distress. Policy and laws effectively minimise the social, economic, environmental and commercial determinants of mental distress, gambling and substance harm, and enable wellbeing. Next slide, please, Kelly. Cool. The next domain is participation and leadership. So the overall vision for this is: we lead and self-determine our pathways through distress, substance or gambling harm to wellbeing and recovery. So the parts under that are: tangata whaiora and whānau co-create and co-produce mental health, addiction and wellbeing policies. Tangata whaiora and whānau work in a wide range of leadership roles and lead projects to achieve full community inclusion. Strategies are led by those of us with the experience of gambling harm, alcohol harm, and harm from other drugs to eliminate the prejudice, self-stigma, and discrimination we experience. This work is valued and supported. tangata whaiora and whānau lead and co-produce services, responses, models of care, research, and training. When using services, we are leaders in our care and decision making. And finally, our feedback actively shapes community facilities, public spaces, support services, and policy.
Thanks, Alana. I'll hand to Guy for the next 2 slides.
Kia ora anō, just getting used to taking the mute off. Yeah, I've got the next 2 domains, but can I just firstly say that the overall goal of the framework is a whānau dynamic mental health and addiction system, where all whānau can navigate distress, reduce harm from substances and harm from gambling, and lead our well-being and recovery. So of the 6 things that we aspire to achieve is as what Alana has outlined with equity, participation and leadership. Access and options is also another one of these aspirations where, we have the right to choose our supports and services that respond to our experiences, needs and aspirations and believe in our capacity to thrive. It was said that the earlier framework from the health and disability concentrated on services. So now we're looking at what it means for our needs out in the community. And this means that we have meaningful choice and support when we are experiencing any level of distress and substance harm or gambling harm, as do our friends and whānau. Our options include kaupapa Māori, peer-led, trauma-informed and family-based supports, harm reduction approaches and access to community and home-based support. We're also looking to achieve communities are enabled to develop and deliver their own responses to distress, trauma, harm from alcohol, other drugs or gambling, and community connections are an accessible first port of call and an enduring resource, including non-biomedical and culturally grounded support. And lastly, that we can assess navigators and peer advocates to walk alongside us in our journeys. The next one we come to is safety and rights. And we want a mental health and addiction system that understands and upholds our cultural, spiritual, relational and physical safety, and importantly, our human rights, where services actively honour our rights and self-determination, where tangata whaiora and whānau report trust and trauma responsive services, free from prejudice, discrimination, punitive practices and racism. Solitary confinement, otherwise known as seclusion, and coercive practices are eliminated, and that the culture of the mental health and addiction system is relational, respectful and values diversity. Also, the workforce is well supported to support us in our whānau, and risk-taking is seen as essential for recovery. Our communities and whānau respond to distress, substance harm or gambling harm in compassionate, non-punitive and inclusive ways. And lastly, under this aspiration is where harm minimisation practices are used in places where people gamble, use alcohol or use other drugs. Kia ora, Kelly.
Kia ora, Guy. The connected care area, people have described wanting supports to work collectively and cohesively for us and see us as valued members of whānau, communities and society. So where all tangata whaiora and whānau can access tools and information to respond to distress, reflect on and minimise harm from alcohol, other drug use or gambling, find support and lead our wellbeing and recovery. Services easily connect us with health, social and justice system supports that benefit us into cultural, wairua, environment and community supports and resources. Our whānau feel hopeful and connected. The system increasingly provides choice-based models of support such as whānau funding models, and education develops critical thinking skills and community facilities provide the resources, internet access, and safe spaces that facilitate our engagement with supports. In our final area for monitoring the systems, focused on effectiveness, supports and services must make a meaningful difference in our lives so that we are self-determining and thriving. We experience self-defined well-being and recovery and benefit from dedicated action to eliminate health and well-being inequities. Services effectively contribute to our holistic well-being and address wider causes of distress impacting us, and support us to regain and maintain hope, purpose, and valued roles in our whānau and communities. Safe processes exist, as well as support and resources for tangata whaiora and whānau to openly discuss any concerns about distress or harm from substance use or gambling. And we experience connection and belonging in inclusive communities that celebrate our humanity, pride, diversity, and recovery stories. So that's the content of the framework, and our next steps are obviously to come and hear feedback from groups like this, to honour that feedback and make changes to the framework accordingly, publish the final framework by the end of June this year. We'll also be publishing summaries of what we've heard from people in these conversations, including a general summary, a Māori perspective summary, and a lived experience perspective summary. We're starting work on the methods and measures. We realise that these are really aspirational statements at the moment, and what's going to be required to monitor the system according to this framework. We'll be very carefully selecting what data is available and where some of those data gaps are and how we might fill them to understand if these things are happening and to what extent across the system. And from next year, we'll begin to use He Ara Āwhina framework for monitoring the mental health and addiction system. So given all of your knowledge and expertise and what we've been able to bring to the table so far through the development of this draft with our expert advisory group and conversations, we're really keen to make this framework as strong as possible to monitor the system in a way that's going to create real change. The questions we're asking people again are around whether the framework and its content reflect your hopes, whether there's anything missing, and if there's anything else you want us to know. So